Hello everyone and welcome to our presentation on Medicare remote therapeutic monitoring. My name is Zachary Edgar and my company is called Therapy Comply. Therapy Comply is a membership-based compliance website that specializes in physical, occupational, and speech therapy. We offer monthly live, full-length continuing education courses, guides and sample policies for Medicare, TRICARE, HIPAA, NCCI, OSHA, and other important federal laws, information and updates for most private insurance companies, including Medicare Advantage plans and Medicaid plans. We are working on PT, OT, and SLP compliance guides for all 50 states, along with information on Medicaid, workers' compensation, home health, and pediatric services. And we offer ongoing and comprehensive support for our members, which means that members can email us with any therapy, compliance, or billing questions for no additional cost. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. Remote therapeutic monitoring, or RTM services, monitor health conditions including musculoskeletal system status, respiratory system status, therapy adherence, and therapy response. RTM is intended for the management of patients utilizing medical devices that collect non-physiological data. Patients are also able to self-report data within those connected medical devices and software, which helps therapists looking to monitor patients' pain levels, tolerance to therapy, and other related data during the plan of care. RTM services can be performed by physical, occupational, and speech therapists. Physical therapy and occupational therapy assistants may also perform RTM services under the general supervision of therapists. That means the therapist can be off-site. When services are performed by PTAs and OTAs, the CQ and CO modifiers must be used. CPT code 98975 is for the initial setup and patient education. RTM for respiratory system status, muscular system status, therapy adherence, therapy response, initial setup and patient education on use of equipment. Report this code only once per episode of care and only if monitoring occurs over a period of at least 16 days. Use this code to report the initial time spent setting up and teaching the patient or caregiver how to use the device. Documentation should include the type of device used, the specific education and training provided to the patient or caregiver, and any device setup required. Code 98976, supply of the device for monitoring respiratory system. Report this code only if monitoring a patient's respiratory system and only if the monitoring occurs over a period of at least 16 days. Documentation should include the name and description of the device provided for monitoring the respiratory system. 98977 is for the supply of the device for monitoring musculoskeletal system. Report this code only when monitoring the musculoskeletal system and only if the monitoring occurs over a period of at least 16 days. Document the name and description of the device provided for monitoring the musculoskeletal system. Code 98980 is for monitoring the treatment and management of services. So this is for at least the first 20 minutes. Used to report the first 20-minute increment of the time spent reviewing and integrating the data collected during remote monitoring to inform treatment goals, monitor the patient's progress and adherence to the treatment plan, and provide clinical feedback to the patient or caregiver. Count cumulative time spent in data review and patient-caregiver interaction in a calendar month, not each 30 days. Report the base and add-on codes together on the claim based on the total time and at the end of each calendar month. The base code 98980 may only be reported once per calendar month. Do not report CPT code 98980 unless a full 20 minutes of monitoring has occurred. Document the data gathered from the device, the date and time of the patient and caregiver interaction, and any decisions made that impact the treatment and plan of care as a result of the monitoring. Code 98981 is for each additional 20 minutes after the 98980 code was reported. So you're going to use this to report each subsequent 20-minute increment of time spent reviewing and integrating the data collected during the remote monitoring to inform treatment goals, monitor the patient's progress and adherence to the treatment plan, and provide clinical feedback to the patient or caregiver. Do not report CPT code 98981 unless a full additional 20 minutes of monitoring has occurred. And then CPT code 98980 must have been billed before 98981. 98980 and 98981 are treatment management codes meant to cover the time spent monitoring patient data, which must be done by a qualified healthcare professional, either a therapist or assistant. These codes apply to a calendar month, are time dependent, and require at least one synchronous communication session with the patient. That could be a phone call or a video call. Text conversations do not fall under synchronous communication and therefore are not billable. Limitations on billing. 98975 can be billed once per episode of care. An episode of care begins with the initiation of the RTM service and terminates when the targeted treatment goals have been achieved. 98976 and 98977 can be billed once per 30 days, and 98980 and 98981 can be billed once per calendar month, regardless of the number of therapeutic modalities furnished in that month. The device used for RTM must fall under the FDA's definition of a device, an instrument or apparatus, implement, machine, contrivance, implant, in vitro reagent, or other similar or related article, including a component or part or accessory which is recognized in the official national formulary, intended or used in the diagnosis of disease or conditions, or in the cure, mitigation, treatment, or prevention of the disease in man or other animals, but in this case it would of course be a man or a woman, intend to affect the structure or any function of the body of the man. A device should be either approved, cleared, or registered with the FDA. You can check a device's status and devices at FDA. So you can look on the FDA's website and you can look up the device to see if it is recognized by the FDA. These are the fee schedule numbers for Medicare and the national payment amount. The payment will differ depending on your area. For 98975, $19.32, 98976, $50.15, 98977, again $50.15, 98980, $49.48, 98981, $39. Thank you for watching this presentation. If you enjoyed it, please like and subscribe, and please visit us at www.therapycomply.com.